ये वाली ना जूम वाली।
हाँ ये उसको भेज दो।
क्यों मेरा ये बंद कर दो ना, मैं वाईफाई अपना हॉटस्पॉट।
आगे क्या साइड आ गई है, नहीं तो रहने दो ना,
चलने दो।
लाइट तो।
हाँ चलने दो बाबा में। अरे जैसे क्या जल्दी मची हुई है इसको।
We have technical team here. Technical support.
नहीं
Okay.
मेरे
Sir,
को देखने को बोलो भैया।
sir,
Yes,
good
yes.
evening.
Yes, sir. Technical team is here. May I help you?
Yeah, don't make it live
वो
right
slide
now.
यहाँ से
Take 1 minute.
ये चेंज कहाँ से
Okay,
हुई?
okay.
ओके।
Sir, कैसे हैं?
May I start, sir?
नहीं इसमें नहीं।
Will take some time. Technical team will just.
ओह
Yeah.
बात ना करी सको।
Okay, okay.
इसको आप
वापस
लाइव
करने के लिए
कीजिए अभी.
इससे नहीं होता क्या?
इसी में हो जाएगा।
हाँ ये ज़्यादा ठीक लगता है मेरे को।
हाँ चलो हो गया।
हाँ पसंद वो भेजा तेरे को मैंने अभी जो भेजा फिर से मैंने नहीं, अभी फिर से भेजा मैंने तेरे को, देख तो सही जरा। अभी भेजा तेरे को मैंने, देख तो सही जरा। अभी लिंक भेजी मैंने तेरे को, उसको देख लो। हाँ Zoom में अभी भी लिंक भेजी मैंने तेरे को एक। नहीं अभी लिंक भेजी तेरे को मैंने, उसको देख तो सही। अभी अभी फिर से भेजा तेरे को मैंने, वो देख ले जरा। देखिए क्या?
Yeah, Venkatesh, can we start now? If sir is ready, then.
तेरे को भेजता हूँ।
Venkatesh, can you hear me?
Yes, sir.
So everything is okay then. आप
Shall we start, sir?
I think we should start now. Yeah.
Okay, sir. Right. Venkatesh.
Very good evening to all. Yes, sir.
Yes, Venkatesh. Please start.
Very good evening to all the eminent doctors. Thank you so much.
One second. Just please, technical team, just go or live this webinar.
It is live, Harsh. It is live.
Okay.
Venkatesh,
Yes,
आप
sir.
अपना mute कर
Technical
दीजिए.
team here.
आप
We are
सब
live.
साथ में बैठे हैं, साउंड एको हो रहा है, तो आप अपना जो ये है ना स्पीकर, उसको म्यूट कर दीजिए. Because I think you are sitting with sir only, right?
Yes, yes, sir.
Yeah. आप अपना स्पीकर को ना म्यूट कर दीजिए, so that साउंड एको नहीं होगा. Then you can start. ठीक है?
नीचे होको करवा लेते।
Yes, Venkatesh. Please start.
Can you see my slides? Venkatesh?
Sir, we can see the slides.
Okay, no problem. Yeah.
Yes, sir.
Venkatesh, you can start now. Venkatesh.
Yeah, Harsh, he's starting now. He's starting.
Yes.
Yes, Venkatesh ji, let's start the program. Unmute yourself because your mic is on mute. Sir, I think
Yeah.
Mr. Venkatesh is facing some issue. So let's
Okay.
start the meeting.
Should we start? Should we
sir.
start directly? Okay.
No, sir. Sir, wait. I'll just introduce you to the
Okay,
panel group and
Okay.
then
Okay.
maybe we
No
can start.
problem.
So
just
first
go
of
ahead.
all, very good evening to all eminent doctors. So right now, when we are speaking here, more than 80 doctors have already,
Oh,
live.
great.
They are seeing
Great.
us.
Great.
So first of
That.
all, thanks to all the participants, and thank
Thank
you
you.
so much, sir, for joining us for today's webinar. Sir, if we talk about the topic of the webinar is doses reduction strategy in rabies management, the
Right.
role of novel vaccine. I'd
Right.
like to inform, sir, that the Cadila Pharmaceutical innovative product, world
Yeah.
first dose novel vaccine, anti-rabies vaccine, Rabies, has successfully completed 1 year of launch. And if we talk about in this 1 year journey, we have passed our benefit of rabies to more than 40,000 animal bite victims.
That's good. That's good.
100% compliance rate, as well as no adverse effect were reported during this period. So with this, sir, for all the panel, all the participants, I'd like to introduce you to the speaker of our program today, Dr. Ulas Mahajan. Sir, thank you so much for joining us.
Thank
Sir
you.
is currently associated with MGM Medical College, Indore. He is a consultant physician and director of Eureka Hospital, Indore. Sir is having experience of more than 40 years in medical field, served as medical specialist in District Hospital, Indore. Also as ex-president of IMA, CSI, and API Indore branch. Presented lectures and chaired sessions in many national level conferences and received many awards from state government and local administrator for the best services in medical field. Sir, on behalf of entire Cadila Pharmaceutical team and the Travis team, we appreciate your time and we welcome you for this webinar. So over to you, sir. And
Thank you.
to request all the participants to drop down their questions on the screen. Below the screen, they can see the window where they can place their questions. So over to you, sir.
Thank you. Thank you, Sandeep. And good evening, friends. At the outset, I am thankful to Cadila Pharma and especially all the team members for giving me this opportunity to talk to you on this very important development in the field of rabies prevention. As you know that rabies is a disease with 100% mortality, but can be prevented 100% by taking course of anti-rabies vaccine. And there has been tremendous development in the field, and the latest one is by the Cadila Pharma for giving this only 3 injections of anti-rabies vaccinations. So with this few words, I would like to start with my slides. Today's contents will be like rabies rabies disease, then the animal bites incidences in India, epidemiology of rabies, evolution of rabies vaccine, challenges, the unmet need, introducing the rabies, novel technology, clinical study phase 2 and phase 3, and takeaways. So as you know that this is the structure of rabies virus, in which there will be, it's as you know that the rabies is a zoonotic disease. The diseases which is transmitted by the animals to human are called as the zoonotic diseases. And as you know that the rabies is number one of them, but the other diseases are the blastomycosis, the psittacosis, anthrax, brucellosis. These are other diseases which are called as zoonotic diseases, which are spread by the animals to the human beings. But the rabies is the worst of it all, because we know that the 100% mortality is there with the rabies. And you know the cause by the rabies virus, that is RABV. This virus is encoded by 5 structural proteins. These are the this is the structure of the rabies virus, in which we can see that there is the G protein, there is the N protein, P protein, M protein, and L protein. These are the 5 proteins are there, and there is the envelope and the RNA is there. So this G protein is the major antigen in the formation of neutralizing antibodies against the rabies. As you know, the epidemiologically, we know that globally 59,000 rabies deaths occurring per year. And in India only, there are about 20,000 rabies deaths per year. Just imagine, about 40 to 50% of the cases are in India only. And these are out of these 20,000, 91% deaths are in the rural areas. So this is when, as I was talking to you from very beginning, that the rabies is 100% fatal, but 100% vaccine preventable disease. So if you take vaccine, definitely you can prevent rabies occurring. And now this is the rabies evolution of the rabies vaccine. We started long back in 1885, just imagine. And that was the live attenuated vaccine from the spinal cord, in which non-standardized dried preparations were there, and up to 31 injections of increasing immunogenicity has to be taken, and that too on the abdominal wall. And just imagine the second one, which started was in 1911. And this 1911 injections, they were inactivated vaccines, brain up to 10%, and in which the minimal neural content and liquid preparations were there. I have used this particular vaccine when I was in charge of Hukumchand Polyclinic long back in 1984-85, because that time this cell culture vaccines were not available in the government setup. So when I was in that government hospital, during that time, I have used this particular vaccine over there. Patient has to come over there for 14 days in a row, and then 14 injection has to be taken on abdominal wall, and subcutaneously it has to be given. And we have seen so many complications of this particular vaccine in our practice, because of that there are some neurological complications are there. Patient can develop myelitis, paraplegia, even encephalitis is also known with this type of vaccines. And then from 1976 onwards, then the cell culture vaccine came. It was an inactivated vaccine from the cell culture. The standardized immunogenicity lyophilized vaccines are there. And here they have to take 5 injections of 0.5 to 1 ml on days 0, 3, 7, 14, and 28. So this practice was going on since 1976. But basically in government hospitals, it started somewhere in 1990s. So before that, although it was available in the private setup, but in government hospital, it was not available till 1992. So this I'm talking about the cell culture vaccine. But here also we have seen that the 5 injections are also difficult to take, because the doses are of 0, 3, 7, 14, and 28. Most of the patients, they come for about 0, 3, 7, but the another 14 and 28 patient just disappear. Most of the patient disappear, and because of that they couldn't take the complete course of vaccine therapy. Now the current challenges with this, as you know, that the current rabies vaccines are cell culture vaccines, that is CCV. It is inactivated vaccines, are more than 50 years of old technology. It is inconsistency in potency, stability, short supply is always there, and adverse effects are also there. And there is decreased compliance beyond 3 injections. As I was talking to you, after 3 injections, most of the patients, they disappear, they don't take further injections, and because of that, chances of development of rabies are always there. Now, these are the current challenges. As we know that the non-compliance is a major issue, and decreased compliance is there after the 4th and 5th injections. So after up to 3 injections, patients usually come up to about up to 3 injections, but in 4th and 5th injections, the patient's dropout rate is about 40 to 50%. Meeting the unmet medical need, This is the introducing a novel vaccine. Now we are coming to the latest vaccine, that is a novel vaccine with simple and shorter regimen. Here, this is the introduction of the rabies injection. Now, this is the latest vaccines available. It is the recombinant rabies G protein. When I was talking to you, the 5 proteins were there, and out of them, the G protein was the most antigenic. So, this is recombinant rabies G protein vaccine. Rabies is there. And here is the first protein subunit vaccine, which prepared by the VLP platform technology. This is the first vaccine with 3-dose intramuscular regimen of 0, 3, and 7 days. So this is very, very important that only 3 doses has to be taken of this particular vaccine. Better compliance due to easy to flow regimen and less visits are required, and convenience, ready to use. No reconstitution is needed in this particular vaccine. So there are all the advantages with this vaccine, that this is a VLP, that is the latest technology, and the first vaccine with the 3 doses intramuscular regimen. This VLP technology. So what is this VLP technology? Now, as you know that there is a native virus is there. With that, there is a G protein which I was talking to you. The G protein is difficult to stabilize, but here they have stabilized it, the G protein isolation, by using the VLP technology, that is called as virus-like particles, purified and stabilized by the Cadila Pharmaceuticals Limited. And this VLP, that is virus-like particles, are protein complexes, exist as a nanoparticles. And these VLPs are similar to native virus particles, but that do not contain the viral genome. So this is very important. It is VLPs are similar to the native virus. So because of that, the antibody formation is sufficient enough. But at the same time, there are no chances of development of rabies because of these vaccines, or no side effects are also there because of this vaccine. They cannot replicate, but can mimic the viral antigenicity without being pathogenic. As I was talking to you, that because it can replicate, they cannot replicate, and because of that, there is no chance of developing any complications. They are capable of inducing a strong humoral and cellular immune response. So because of this vaccine, there is good humoral and cellular response, and because of that, the antibody formation are sufficient. And this is called as the VLP. VLP as a vaccine is available over here. So what is the VLP technology? This was the original research article was there. A novel recombinant rabies G protein vaccine, that is rabies. A VLP-based rabies vaccine is there. And this was there into APCRI journals also, in which Dr. Sumit Podar and Dr. Was the first person who started, was given this particular, this in the original research article was there with this. And here they have given the details about this particular vaccine in this particular journal. And this clinical phase 2 trials, in which the study design was that it was compared with the original vaccine, that is the Ravipur vaccine, in which in study design, the 3 doses, the 0, 3 doses, 2 doses and 3 doses were used in 10 microgram, that is number 50, and 10 microgram is used for 3 injections, and 10 microgram used in 2 injections. And it was in Ravipur, there was about 25 patients in which it was used for 5 injections. So with this, they have seen that it can be compared, the seroprotection can be compared with the Ravipur vaccine, even up to the days of 270 days. So days post immunization. So up to 270 days also, there was the immunogenicity remains, the antibodies remains over there, and it is as good as the Ravipur vaccine, particularly as far as the antibody formations are concerned. And this is the clinical phase 3 study, in which the safety and immunogenicity of a novel 3-dose recombinant nanoparticle rabies G protein vaccine administered as a simulated post-exposure immunization, a randomized comparator controlled multicenter phase 3 clinical study was done, and in which it was compared again with the Ravipur vaccine. And here they have observed that this is the phase 3 study was to evaluate the immunogenicity and safety of rabies G protein vaccine administered as a simulated post-exposure immunization in healthy volunteers. It randomized comparative controlled multicentric study was there. Total subjects were 800. Randomization was 2:1. So in which 533 subjects were for the rabies and 267 subjects were for the Ravipur vaccine. The Thrabies was given for 3 doses, that is 0, 3 and 7 days, and the Ravipur was given as usual for 5 injections, 0, 3, 7, 14 and 28. And then it was observed that the study design and objective of the study was to demonstrate the non-inferiority of the test vaccine to the comparator vaccine, that is with the Ravipur. And the primary objective was subjects with seroprotection at 14 days post first dose. That was the after first dose, how much the seroprotection RVNA titer was more than 0.5 international units per ml. And then the secondary objective was to subjects with seroprotection at day 42 post first dose of the test vaccine, safety by monitoring subjects with adverse events. And the seroprotection, the protection obtained by the vaccination, that is the human vaccine, immuno other, which was in 21 November. So it was compared with the Ravipur vaccine in all these parameters. And then it was results wise, it was observed that the results were consistent across different age groups and genders. Observed difference of 1.52% with a pre-specified margin of -4%. This non-inferiority for the seroprotection primary endpoint day 14 and 42 were met, and test and comparator are identical in the seroprotection rate both on day 14 and 42. So with that, they have seen at the safety point of view, it is better, the efficacy wise also it is better, and safety wise also it is better than the comparator band. So Thrabies has better safety profile as significantly less adverse effects were seen compared to the reference vaccine, that is with the Ravipur vaccine. So here it was observed that if with the fever it was there with Ravipur for about 1.50%, it was hardly 0.38% with the Thrabies injections. And then it's in a similar way, the headache, urticaria, joint pains, and nausea, these are the minor side effects which were observed with both the vaccines, but it was comparatively quite less with the Thrabies as compared to the Ravipur. The local adverse effects, as we have seen with the localized pain and redness and swelling, which was also quite less with Thrabies as compared to the competitor brand, that was Ravipur. So it about 13.56% patients were having localized pain in Ravipur. It was hardly 7.69% cases of localized pain in cases of Thrabies. So in a similar way, it was 3.37 to 2.81 into the redness and 1.87 to 0.75 into the swelling part. So overall also we have seen that the percentage of adverse effects, if we combine together, 17.2% minimal side effects were there with Ravipur, and 9.9% minor side effects were there with the Thrabies. So we have seen that the efficacy wise, it remains the same with the Ravipur, but the side effects profile are quite less in Thrabies as compared to the Ravipur vaccines. So study conclusion was that the Thrabies was non-inferior to the reference vaccine, less adverse effects compared to the reference vaccine, and novel 3-dose Thrabies was found to be safe and immunogenic and was comparable to 5 doses of WHO pre-qualified vaccine. So we have seen that these 3 doses were equivalent, and safety point of view, it was rather same with the WHO standard of the Ravipur vaccine. So with this, because of that, we have got these people, Thrabies has got award also, the Pharma Innovation of the Year by the Economic Times, and also got the Golden Globe Tigers Award by Malaysia for Innovative Product of the Year. Thank you, friends. Thank you so much. So if with that we can see
Yes, sir.
that the efficacy wise also this is very good, and the side effect profiles are also very less. So with that, I would like to ask if there are any questions or queries, you can ask me because I am here. Thank you so much.
So, sir, thank you so much, first of all, for a very good informative session. Sir, it is really wonderful. And I know, sir, like in past also, you have done so many webinars for us, as well as some CMEs. And the kind of feedback which we always receive from our field side is, sir, sir has a very good command over anti-rabies vaccine, not only for therapies, I'm talking about the overall therapy. So first of all, sir, thank you so much for this informative session. And there are certain questions, sir, regarding which I have received. I just like to read few points. Like one is related to the sign and symptom of rabies in humans. So if you can just elaborate over this point, sir.
Well, as you know that rabies basically is a fatal disease. If somebody has been diagnosed with rabies, definitely we are sure about it that there is no therapy for rabies illness, and ultimately patient has to die. So usually the patient comes with a minor complaints of throat pain and fever, mild fever and body aches as usual as a viral infection. But after about 2 to 3 days time, then there is trismus is there, then muscle spasms are there, and ultimately patient die of a respiratory failure because patients are choking because of that. Then it is also called as hydrophobia. Another name for this is the hydrophobia, and this hydrophobia name comes because of that patient gets esophageal spasms. The laryngeal spasms are there because as soon as patient sees the water, so because of that, it is called as hydrophobia also. I have seen these type of patients because when I was doing my house job and my residency, that time I was posted in the infectious ward in Indore also. And that time I have seen the patients suffering from rabies. And it is really a tragic death. I have seen because we know that we cannot do anything for these patients. Ultimately, patient has to die. And only treatment available that time was the muscle relaxant. The Robinexol, I still remember the name of those injections and tablets. The Robinexol was the tablet and injections available that time just to give to these patients for the muscle relaxation. Otherwise, just a routine treatment of antibiotics and has to be given for 3 to 4 days. Most of the patients, they die in about 3 to 4 days time. Once it is diagnosed as rabies, most of them die within 4 days of time.
Right, right, sir. Sir, one more point I would like to ask you regarding your in-clinic experience with rabies, sir, because I know you have
Well, actually, I was in charge of anti-rabies center in Hukumchand Hospital. So I
right,
was in charge for there for 5 years. And
right,
I would like to tell you that I had been to Kasoli.
right,
Kasoli was the place where this vaccine is manufactured. So
right, sir, right.
government of India had sent me over there for 7 days of training in Kasoli, long back in 1991, 92, I'm talking of. So that time, because
Okay.
that time only vaccine available was that which was usually the 14 injection has to be given in those days. Even that
Right.
cell culture vaccines were also not available that time in government hospital. So because of that, government had sent me over there for 7 days of training, and I attended that training also. But that time, another way of the manufacturing was the ARS, anti-rabies serum was also manufactured over there that time. And
Oh,
anti-rabies serum has to be given in those patients in which patient the class 2, class 3 wounds are there. If
right,
patient dog has bitten you on the face or on the hands, so they are considered to be a class 3 wounds. And in
right.
those patients, chances of development of rabies are fast, and because of that, in such patients, we have to give the passive vaccination, so in which anti-rabies serum has to be given. That is called as ARS. And
Right.
nowadays also the immunoglobulins we are giving in the latest treatment, immunoglobulins are available,
Yes.
in which immediately it will start acting. And because vaccine takes some time, even if you are giving rabies or Rabipur, it takes at least 15 to 20 days to start acting. So
Yes.
because the antibody starts developing after about 15 to 20 days of time. So during that time, if patient, we think that the patient may develop rabies before that, before 15 to 20 days. So in these patients, it is mandatory to give anti-rabies serum in those days. And nowadays, the immunoglobulins anti-rabies we are giving, and these immunoglobulins has to
Right.
be given in these patients. It has to be given, sometimes it has to be
Right.
given locally also at the time, at the site of injection, at the site of bite also, we have to give these injections over there. So this is the therapy nowadays.
Right.
It has changed a lot.
Right.
Because of that, we have seen that the side effect profiles are not there at all. In those days, we have seen so many patients dying of complications of the anti-rabies serum and vaccine. Anti-rabies serum, I have seen anaphylactic shocks with anti-rabies serums because there was no
Oh,
immunoglobulins available those days. So anti-rabies serum, I have seen deaths because of the ARS anti-rabies serum that time. And
right, sir.
because anti-rabies vaccines also had many of the complications, particularly this paraplegia and the transverse myelitis. These were the complications were there with that.
Right, right. Sir, I can see Dr. Prasanna Jain has raised his hand. So,
Yeah,
Dr. Prasanna, if you have any question, then you can ask Dr. Mahmood. Hello. He's raised his hand.
Yeah, Prasanna,
So,
please. Prasanna, please unmute yourself first and then please ask me.
I think-
I think by mistake,
I think he might have.
yeah, yes, just.
Yeah, maybe. Yes. Sir, any experience with Travis when you
Yeah,
have
yeah. Travis, well,
given the
I'm
benefit
using
of
Travis for last about 2 months, particularly when I had my last lecture also in the hotel Crown Palace. I
right,
did
right, right,
3 months back.
right, sir.
And after that, I think I have already given my this vaccine to about my 5, 6 of my patients at least. And everybody has got very good
Okay.
response. And there are no side
Right,
effects
sir.
at all. Absolutely, because
Right, sir.
only 3 injections has to be given on 0, 3, and 7 days. And
Right, sir.
absolutely, there are no side effects. Even in any of my patients, I have not seen even the local tenderness or local redness also. So
Yeah.
all of them are doing well and without any side effects or complications.
Thank you, sir. Sir, from our medical side, Mr. Harsh is also with us. So,
Yeah.
Harsh, if you have any point, latest updates you want to give in terms of pediatric trial or something
Yes, yes.
regarding Travis, you can share with the group. Yeah.
So first of all, thank you very much, sir. It was a very nice session, and you have covered all the aspects of, starting from the disease as well as the current limitations of current available 5-dose vaccine, and what should be the advantage of Thrasis and how patient can get benefited with the newer vaccines. Apart from that, sir, just recent advancement of these particular vaccines, which I am telling that, because it is considered as a new drug. Okay, so that phase 3 trial, which we did for Thravis, in which we have taken only adult population, because no
Right.
regulatory authority which was giving permission to do or conduct the trial in specific for special population like pediatric. So right now we have an approval for this particular vaccine in adult population. But at the same, like if we go through the WHO guideline or recommendation, they are definitely saying that all the rabies and anti-rabies vaccines which are available in the market or which are approved by regulatory authority, they don't have any kind of contraindication in special population, specifically for pediatric as well as pregnancy population, because
Pregnancy also.
it's 100% fatal disease. We can't let patient under vaccinated
Exactly.
or not
Exactly.
vaccinated.
Right,
And because of this, right now we are conducting specific phase 3 trial for pediatric population, which is ongoing. We have already enrolled more than 350 pediatric volunteers in this study. We are just yet to get the results because we have taken their samples, which is to send to Nimans for seroprotection or for check the antibody titer. So once we'll get the data, maybe in next 3 months we'll have a strong data specifically for Thravis in pediatric population.
What is the age group which we have taken?
Yeah, so for that, sir, we have taken 2 groups. In one group, we have taken the age of 1 to 9 years of age, and in another group, we have taken 10 to 18 years of pediatric population. So that's why, and almost 350 volunteers we have already enrolled. And enrollment is completed, sir. Just wanted to waiting for the data results of seroprotection levels of that particular volunteers. Apart from that, we are also doing post-marketing survey, as the it's a mandate of DCGI if we are launching any new product. So it is already going this PMS very soon, maybe in next 3 months we'll also publish the data of PMS. So this is about the current advancement or current the procedure which we are doing for Thrabi specifically, sir.
Right. Here, I want to give some specific data also, because I have gone through the literature also. India has 60 million stray dogs. Do you know about it? 60 million stray dogs are there in India, and 25 to 30 million paid dogs.
Yes, sir.
Just imagine the number of dogs.
Number of stray dogs.
And yeah,
it is like the population of some of the country like Australia or Canada. They are having the population of 6 crore. We are having 6 crore stray dogs only.
Stray dogs only.
Yeah.
And out of the dog bite, out of the rabies patients, 97% of the patient deaths are because of the dog bite.
Yes.
And
yes,
remaining are by the cats or by the horses or by the other cattle. But 97% are by the dogs only. And you'll be
Right.
surprised to know that the number of patients maximum are in Chhattisgarh. Number of
Right.
deaths occurring because of this thing.
Right.
I was thinking it could be in UP, but Chhattisgarh has got maximum number of deaths because of
Right.
about 3.5% of the deaths which are occurring in India are in Chhattisgarh only.
Yes, sir.
And next is UP and next is Odisha. MP is luckily quite less from that angle, but
Right.
definitely the number of cases which we are seeing in India, the dog bite cases, are definitely more in Indore also. Although because the prevention part aspect is good here in the Madhya Pradesh, I think. So because of that, we are not getting that number of rabies patients in Madhya Pradesh at least.
Right, right. And it is also about the awareness to
Yeah.
the general population, because
That's
even
true.
I have heard from some doctors that they don't know this is vaccine. The patient or perception is like these are the injections. And for
Exactly.
normal, in case of category 2 bites, within next 7 days, this particular whatever the wound is there, it got healed. So the perception of the patient is ki I am okay. Now I don't
And
want to take any kind of vaccine.
another misconception was that if you are previously it was true that if you are observing dog for 10 days and dog remains all right, there is no need to
Right,
take injection. But the latest concept is that whether dog is alive or not, whether patient with dog is
right.
pet or not, you have to take injections.
Yes,
And
yes, sir.
particularly with this newer vaccine, because it has to be taken only 3 injections. So it is really good that you have to complete this course in 7 days of time. So
Right,
I
sir.
think it is necessary that each and every patient, because I have seen patients of rabies after 18 years of dog bite. After 18 years of dog bite, just imagine.
Oh my.
There was no history in between, but patient was given history that he had dog bite 18 years back.
Oh,
So sometimes the vaccine, the disease can take very long time for the development, because it depends sometimes on the immunity of the patient also. If the immunity goes down, then suddenly the vaccine, this virus starts replicating, and then they can develop rabies illness. So because of that, it is very, very mandatory, they're essential to take vaccine in all the patients of dog bite. This is very important.
right, sir. Right, right. Thank you. Any questions, Sandeep? I think.
I think most of the things we have already covered, and the session was so informative. And sir, actually, why Mr. Harsh also wanted to speak to you, because he has also planned the time, the meeting, which the CMA, which was there, but unfortunately,
Yeah, yeah.
due to some
That
travel,
time,
some other
yeah, yeah,
adjustment, he didn't able to join that meeting.
yeah, yeah,
But
yeah, yeah.
next month, definitely we'll plan one meeting, because we want to spread awareness, sir. And
Exactly,
Cadila is
exactly.
dedicated,
No, definitely. I
and
think
we
it
are
should be spread further, because this is very good vaccine. I have used it myself in my most of my patients, and
right,
I'm
sir.
getting good results with that. So definitely, I think this is our duty to that each and every doctor should know about this vaccine, so that they
Yes.
can use the proper vaccination in
Yeah.
most of our patients.
Yes, sir. Sir, I just want to add few points here, that in
Right.
terms of, the government of India was talking
Yeah.
about the motto of eradicating rabies from India by 2030. Kerala is
Yeah.
aligned to it, and with the help of rabies, we are spreading a lot of awareness, sir. From this month onwards, more than 30,000 clinics we are focusing, and we are pasting our patient education poster, where we are highlighting, do's and don'ts of rabies, as well as our 3 dose. So
Yeah.
that is the one step. And today, sir, this webinar, which is happening right now, such
Yeah.
type
Yeah.
of 50 webinars across India, sir, we are planned. So north
Yeah.
and
Yeah.
west covering today.
Yeah.
And next week, we are covering east and south zone.
Yes.
So
Yes. Yes.
as far as today's number is concerned, more than 5,000 numbers already we have. So this is
Good.
the
Good. Good.
initiative we have taken, and definitely we'll month on month, we'll do such kind of program, but we need help from the
Yeah.
respected doctors like you, who can speak and we
Sure.
can
Sure.
tell about,
Oh,
not
yes.
only
Sure. Sure.
about
Definitely,
disease.
definitely. I am here always to help this particular thing. There's no doubt about it. Thank you so much.
Thank you so much. Thank you so much, sir. Thank you
Thank
so
you so
much for
much.
your
Thank you.
time, and
Thank you,
thank
Harish,
you, sir.
and thank you,
Thank you, sir.
Sandeep.
Thank
Thank you
you.
so
Thank
much.
you very much.
Thank
Thank
you
you, sir.
so
Thank
much.
you. Thank you, sir.
Thank you.
Thank you.
Thank you so much, boss. Thank you.
Thank you so much, sir. Bye.
Thank you. Okay, bye.
Thank you, everyone. Bye.
Thank you so much, boss.
Thank you, sir.
Yes, sir. आवाज क्यों नहीं आ रहा? स्पीकर कहाँ है?
वेंकटेश सर,
Yes, sir.
सर टेक टीम से बात कर रहा हूँ सर। सेशन खत्म हो गया है, सब लीव हो रहे हैं।
Okay, okay, sir.
Yes.
संदीप सर कुछ बोल रहे थे? क्या उसमें कुछ आवाज नहीं जा रहा है क्या?